Welcome to EAU podcast series, Exploring Urology, a Roadmap for Medical Students. In this fifth episode, Cutting Edge Technology and Innovations, we are joined by Dr. Angelo Territo and Professor Marcio Moschovas. From the latest advancements in robotic surgery to innovations improving patient outcomes, they highlight how technology is transforming the field. Whether you're considering urology as a career or are simply curious, join us as we uncover why urology is an essential part of modern healthcare and an exciting career path.
Good evening, everybody. It's a great pleasure to be here. My name is Marcio Moschovas. I'm here with Angelo Territo, and I'm from Orlando, Florida. I work with Vipul Patel. And Angelo, please introduce yourself.
Hi, everybody. This is a pleasure for me. Grateful with the EAU and the section of European School of Urology in giving such talk on innovation in technology. We have the pleasure together with our colleague and friend Marcio to present the last improvements in robotic surgery as well as in endourology, mostly related to upper tracheal cancer. So please, Marcio, you would like to go ahead.
So we're going to talk a little bit today, some innovations that we have in medicine. I will talk a little bit about robotic surgery and recent innovations, plus a little bit of telesurgery, which is something that we're doing. And then Angelo will complement with all the other topics, all the other interesting topics, imaging, AI. So I think it's important when we talk a little bit about robotic surgery to know how it works and how it was designed initially in the 80s. Actually, it started 60s, 70s with the American Department of Defense, DARPA, with a concept of telesurgery. That's correct. So they start thinking about telesurgery and then they projected robotic surgery. But telesurgery did not get any traction on that time because of the machines. They were not that good, and the connections as well. So we started the first procedures in 99, 98, 99. And then from the last 25 years, we've been seeing the robotic surgery getting a lot of traction and becoming actually the current way of doing, especially in uro-oncology. One special attention that I would like you guys to pay is in 2019, which is a landmark period for robotic surgery, because that's when the most common producer stops having the advantage in the market. They were exclusive until 2019, and since the 19, we have some new platforms coming out. So that's a very interesting data and time frame to get, because from this point now, we have more than 40 robots in the market. When we have a look at all the literatures and some literature reviews by our group and some other groups showing how many robots we had since 2019, it's impressive. We have single ports, we have multi-ports, endoluminal, different names of platforms, different brands. So this is very interesting because Asia had a big boom in this production. And it's a really, really important data, because now we have some new platforms with a multi-modular mixing the current platform that we have, which is the intuitive, with some other features like open console. So that's a very, very interesting data. We've been working with a lot of companies from Asia. So they're designing some different platforms that we have, and pretty much most of them, they have a telesurgery connectivity. We've been doing a lot of research in different platforms with some results, some good results showing that they don't have too much difference. So we have the closed console concept. All of you guys will see in your center, which is the surgeon sit down and put the forehead in the console, and some open consoles, which are pretty much Medtronic, Renovo platforms. And they're very, very interesting in terms of competition, because every year we have several machines in the market. And when we're talking about these type of machines, now we see in Europe the new single port arrived. It's kind of increasing the number of contenders in the market. We have closed console, open console, single port, and all of them are looking for bringing benefits to patients and surgeons as well, because you can improve the posture, you can improve some ergonomics of the operation. So it's a really interesting concept. So Angelo, how many platforms you have in your center? How are you guys dealing with that? Do you want to talk a little bit? I know that your center's great center in all types of aspects in urology, but how you guys see that?
Yeah, thanks for this question, Marcio. In our center, we have I'm still working at Fundació Puigverd Hospital since 2018 as faculty. Fundació Puigverd Hospital is in Barcelona, Spain. In our hospital, we have Da Vinci system, conventional platform, XI, and since 2022, we have also Hugo system provided by Medtronic. We try to employ both machines in our routine activity for the most complex procedure in our hospital. Laparoscopy is still alive, but robotic surgery is more and more used for the majority of pelvic procedures, such as prostatectomy, radical cystectomy, and partial nephrectomies in case of renal surgery. So in this moment, we have these two platforms available for both public and the private system.
That's great. And having this transition from the multi-port for all of you guys that are listening to us is the conventional platform. That's the platform that's been in the market for the last 25 years. How do you see this kind of competition between the companies? How do you see this type of new technologies in the market, especially for surgeons and patients? What's your opinion about this variation and this multiple options that we have now?
Well, this is a great observation, Marcio, because Hugo system provided by Medtronic is a new platform with features that are totally different compared with the Da Vinci system, with the Da Vinci platform. First of all, the console is an open console. And in my opinion, the vision is provided by Storz, accompanied by Storz scope, is a superlative vision. I don't want to do any comparison because it's not my business, but the Hugo system provides a very good vision in terms of console. Is an open console. So from a surgeon point of view, you have the full domain of the OR, looking for potential conflict that you have on the table, and you have really easy communication, truly easy communication with your assistant on the table and with your scrub nurse, with assistant nurse, with all the OR colleagues. The docking is a new concept because we have 4 arms that are single arms. So the docking at the beginning could be considered a little bit tricky. Maybe it's not easier like we get used to do with the Da Vinci system, the conventional platform of Da Vinci system, because these are docking that you have to do for any single arm. So at the beginning, it requires training. It requires a little bit more in terms of surgical time. But in the end, from an ergonomical point of view, the precision of the movement emphasizes every day more and more. So I think that we can say that we are very happy also with the Hugo. Da Vinci, so to me, is still the conventional robot, and as someone has already said, all the comparison that the machines should do in the future, in the upcoming future, will be comparison with the conventional Da Vinci system. In the moment, the main machine in the market.
So for you guys that are listening to us, when we talk about dock, it's pretty much to connect the robot with the trokers. The trokers are the ones that we're going to place in the patient to have the instruments going in. So the docking is pretty much connecting the robot with this troker. And I think the take-home message, as Angelo was nicely talking, is that now we have more competitions, and now we have more contenders in the market. So pretty much this, I believe, is going to decrease a lot the price. As soon as you have more competition, you're going to improve the service, improve the technology, because now this factories, this companies, they need to kind of fight each other to get in the market. And I think it's good. It will benefit surgeons, hospitals, patients, and everybody. Competition always improves the quality of life of people. And also the second point here, as I said, we have several platforms in the market. We have some literature reviews, some nice literature reviews about it. And also something that I briefly mentioned is the telesurgery capacity that these machines are doing, mainly the Asian new machines in the market, Microport, WeGo, we have Can Do, we have Edge, but pretty much the biggest one is a Microport company. But in all these companies now, they're doing telesurgery, which is remote surgery. So you guys gonna see in the next years all this conversation about remote surgery, surgeons operating in different continents. And we believe that this has a big humanitarian impact because you can attend areas that don't have this big expert. But this is a future conversation. Also, robotic surgery, what is really important to say in this last year is robotic surgery improved other areas of technology, brought some other technologies besides the robot. Some other areas were improved with this new technologies coming in the market. So, Angelo, can you tell us a little bit your experience and all the innovations that you've been watching in the market, that you want to talk a little bit your experience with AI, with augmented reality, all the nice things that you've been doing in your center?
Yes, it's a pleasure to share our experience in our hospital with a few improvements that we have done also in robotic surgery. And in fact, following your observation and your talk, this is something published recently by the group of Professor Popilla of the University of Turin. Artificial intelligence, in this case, in this study, was able to recognize bleeding with an accuracy around 90%. 3 seconds in advance. It means that artificial intelligence can be used also in terms of training. We are going to talk also about training in urology, training in robotic surgery. Extended reality as well is something new, is something interesting because nowadays what we can do in complex procedures such as, for example, the partial nephrectomy, we can combine the 3D augmented reality, the extended reality with ICG in order to drive the surgeon in the identification of the mass, identification of the lesion, so to keep going properly with the enucleation or enuclear resection. Other improvements are, as you already know, because we have a lot of experience in robotic surgery and even renal surgery and prostate, the 3D reconstruction, talking about the partial nephrectomy, the 3D reconstruction allows to give crucial information, crucial data on the vascularization of the lesion, of the branch supplying the lesion. In this way, we are able to do a selective clamping. Selective clamping means to reduce the ischemia, the overall ischemia of the kidney, in order to reduce the potential detrimental effect of the ischemia on the entire kidney. This is the future since more and more we are working on partial nephrectomy. We are offering partial nephrectomy even for complex cases, even for cases of T2 that 5 years ago were cases to consider only for radical nephrectomy.
Just one point here for everybody that is listening to us. When we talk about partial nephrectomy or radical nephrectomy, partial nephrectomy, we pretty much is that surgery that we're preserving the kidney. So pretty much we need to preserve the kidney. We have a tumor and we go there and kind of scoop the tumor out from the kidney. So that's the 3D reconstruction that Angelo nicely spoke to us. This 3D reconstruction, you're going to detect all vessels, the veins, the arteries, and then you're going to do a safer surgery with better outcomes there. So that's a really, really interesting material that Angelo has. Sorry for interrupting. Go ahead, Angelo.
As far as the kidney transplant is concerning, kidney transplant is one of my topic. I would say one of the main limits of the robotic surgery in kidney transplant is to use the robotic surgery in patients with calcification of the artery. So in order to overcome this limit, what we have done, publishing the results in 2022, was a 3D augmented reality study in order to identify the calcification with the superimposition of the image coming from the CT scan with the intraoperative image of the artery. In this way, the aim of the study was to obtain the ability of a correct place for vascular clamp and to proper doing the arteriotomy based on 3D model. It means that using this technology, we can skip the calcification over the artery, and we can carry out the arteriotomy in the right place in order to avoid any potential vascular complication in patients with vascular calcification that, again, I would like to emphasize so far, is one of the main limits to exclude these patients for robotic surgery, for a robotic approach for kidney transplant. Still in kidney transplant, there is another problem that we have tried to solve it in the last years. The problem is related to the capacity, the possibility to maintain at constant low temperature the graft during the vascular anastomosis. So far, what we've used is a gauze filled with high slush. What we've done in collaboration with the Grena company was to test before in animal model, thereafter in human, the possibility to use this machine, this device, this jacket, as you can see. But it's a jacket, basically, is a jacket to cover the kidney, to cover the graft before doing the kidney transplant. In both settings,
we're talking, and Angelo is showing some nice videos that I've seen Alberto presenting as well. Could you tell everybody that is listening to us the name of this paper? Because it's a very, very interesting paper, guys. I'll suggest you to read, to have a look at the video, because it's something new, something that will make a lot of difference in the transplant while you're doing the schema. So it's a really, really nice paper with some nice videos here. I'd like Angelo to kind of read the title of the paper so you guys can look at the internet. You can send him some questions. Angelo, please.
Yes, the title of the paper is Step-by-Step Development of a Cold Ischemia Device for Open and Robotic Assisted Renal Transplantation. First name, myself, Angelo Territo. The paper was published in 2022 on European Urology, Surgery in Motion. It means that people interested in kidney transplant, interested in technology, or just interested in reading this paper can also enjoy to watch the video, the correlated video that is able to properly explain this device works and what we have done before in animal models, thereafter in human.
Really nice, really nice. Thank you, Angelo.
This podcast, we are talking about the innovation in robotic surgery. Something that we should consider nowadays is the surgical training. Surgical training is crucial. It's crucial because it's not allowed anymore. People go in OR without experience, without hours spent in wet lab, dry lab. Talking about kidney transplant, we're still doing training, delivering training courses at Ors Academy using porcine model. But the brilliant idea of Riccardo Campi from University of Florence was to develop a 3D printed model that's useful for beginners in robotic assisted kidney transplant to perform the main steps of the vascular anastomosis for both artery and vein. Please keep in mind as to start a procedure such as the robotic assisted kidney transplant is required also an expertise in open kidney transplant as well as in robotic surgery. So it is not a procedure for beginners. Using this model that was published, the paper, and with an associated video in European Urology Open Science 2022, with the first name Riccardo Campi and other collaborators. The title is First Entirely 3D Printed Training Model for Robotic Assisted Kidney Transplantation, the rack box. In this video, you can find all the steps of the robotic kidney transplant and how this machine, this box, allows to mimic exactly the movements and that you need to do when you are approaching a robotic kidney transplant. So the dissection of the vessel, the preparation of the vessel, and mostly important, the vascular anastomosis using such suture that is a Goratex suture is a nice suture because it has not any memory that can annoy you during the stomosis. This is a model. It is a box that is that you can use exactly for what we are saying, to train before starting a program in human, and before try the procedure in your OR with your patients.
Really nice video as well.
People interested can find this video on the website of European Urology Open Science in 2020. The paper and video were published in 2022.
That's great, and I think that's the main take-home message. In the last 5 to 10 years, I remember when I did my fellowship in Orsi in 2018. A while ago, Motri started with this reconstructions, 3D reconstructions, and some other technologies in kidney. And I think in the last 5 to 10 years, we saw a lot of advantages over here with this technology, and more some nice groups from Europe, Angelo's group, Alex Motri group. There are several teams that are kind of doing these innovations, and we believe that this will for sure improve the surgical training, as Angelo was showing, the patient outcomes, surgical margin, oncological outcomes. So I think all of you guys that are listening to us today should invest your time in studying technologies, in studying all besides the medicine, the surgical field, or any other field that you're interested in. It's very important for you guys to study this technology with all these experts that I just mentioned above. So, Angelo, any final considerations here? What do you think? This is a conversation that we can take like 2 or 3 hours at least to talk, to explain everything that we're doing.
Yeah, this is for people such fascinated like us in improvement technologies, futures. We can talk for hours. The main message and the take-home message are related to the need for technology in order to improve the outcomes for patients, in order to include the outcomes and some aspect for the surgeon. When we talk about robotic surgery, we should consider also the ergonomy, as you said. We should think also the possibility to do procedure with thousands of kilometers of distance. It means telesurgery that nowadays allows to take care of your patients despite the fact that you are in another country. And we had many examples of what's happening in the last weeks with Alberto Breda, with Marcio, with Professor Patella, and with people that are more and more trying to approach this kind of technology in order to take care of patients in a different way, in a different country. So I think that technology is something that is not only the future, is to be considered also the present, and please, for the young generation, approach the technology like a way to ameliorate the outcomes for the patients.
That's great. So guys, if you're interested in some to watch and to learn a little bit what we're doing, you can search on internet or PubMed Marcio Moschovas or Angelo Territo, and you're gonna find all our work. If you guys need to communicate with us, just send messages through the internet. You're gonna find us very easily, and we're gonna be very, very glad to talk to you and to discuss with you all the nice and cool things that we've been doing in our routine. So to me, my final consideration is thank you very much. It was a great honor, a great pleasure to be here to talk to you guys, with an expert like Angelo as well. I hope I'll talk to you guys in some other episodes, and thank you very much in my part.
Thank you very much, everyone. Thank you. Our grateful to European Urology Association and European School of Urology for inviting us and giving us the opportunity to talk about technology and some topics that we love to deliver. Thank you very much, and please don't hesitate to contact us through the social media. And
thank you, Angelo.
Thank you for this insightful episode. We are sure our listeners enjoyed it. To keep up with the latest EAU podcasts and stay informed on urological advancements, be sure to subscribe to our EAU podcast channel on your favorite podcast app. Until next time, keep learning and stay inspired.